More important.
While addressing the media, the Minister of Health, Dr. Jane Ruth Acheng, says that from the most perturbing questions from the public about the DNA test, resulting validity, integrity, and credibility on the persons and the laboratory taking the role of testing, that has, however, created a state of crisis and tension among Ugandans, and because of the matter, among the measures to regulate the exercise, the Government Analytical Laboratory in Wandegeya, the MBN laboratories in Nakasero are for now the only accredited laboratories from the DNA testing and resulting.
Currently, there are two main laboratories in the country that have been nationally and internationally certified and accredited to run DNA paternity testing. One is the Government Analytical Laboratory in Wandegeya, and the second is the MBN Clinical Laboratories on Nakasero Road. Both laboratories are located in Kampala. These have been certified by the government regulatory authorities, the Allied Health Practitioners Council, and the Uganda Medical and Dental Practitioners Council, and or accredited by international accreditation bodies.
Acheng says that, however, there are several laboratories around the country that are accredited and permitted by the Ministry for Diagnostic and Research, but rather not allowed to carry out DNA tests resulting.
Several other laboratories in Uganda are also accredited and certified to do DNA testing for diagnostic and research purposes, like investigating trends in COVID-19, TB, HIV, sickle cell, hepatitis B, and cancers. And these are the Central Public Health Laboratories, the National TB Reference Laboratory, the Joint Clinical Research Center, and laboratories at Uganda Virus Research Institute, Makerere, and Mbarara universities.
She also mentions other operation oversights, procedures and measures that are to be taken by the government through the Ministry of Health to ensure the effectiveness and reliability of the practice.
The following additional interventions have been planned by the ministry to ensure quality and reliability of DNA paternity testing services in the medium and long term. 1. We'll develop and implement guidelines to streamline DNA paternity testing to ensure quality, legal, ethical, and professional practices are adhered to, and psychosocial structures are available to support the pre- and post-DNA test counseling services. 2. To support in fast-tracking the enactment of the DNA Evidence and Database Bill proposed by the Ministry of Internal Affairs. Overall, this will ensure that A. DNA testing is done only by laboratories that have been authorized for testing through certification and accreditation. B. Only qualified professionals will be allowed to do the testing. C. Only certified laboratories be allowed to collect DNA test samples. D. Only validated methods and technologies are used for testing. And E. The right steps are followed to provide results and information to clients with the necessary psychosocial support, as well as pre- and post-DNA test counseling of affected clients and families.
It should be noted that as families and individuals become so conscious about the DNA testing, the practice, on the other hand, in the previous 20 years, has always helped Ugandans in identifying dead bodies, detecting infectious diseases like COVID-19, Ebola, HIV, and others to predict the risks of developing certain diseases, for example, cancers, determining the paternity and maternity of the children, to mention among many. Henry Mugwanya, live at 8.